COVID-19 vaccine in India soon. The vaccine for COVID-19 is on its way to the Indian citizens. But don't worry, if you feel hesitant, you will be spared from it. There will be no compulsion whatsoever on anyone to get vaccinated against COVID-19, assures the Union Minister for Health. However, the government is planning to spread awareness among people about the pros and cons of the vaccine. Ultimately, it is administered in the best interest of the citizens and for their welfare. All benchmarks laid down by the World Health Organization will be strictly adhered to. The availability of vaccine is limited. Hence, the vaccination process will be in a prioritized manner. The Union Health Ministry has earmarked the first 1 crore vaccinations exclusively for health workers across the country. The next 2 crores will be done on frontline workers including sanitation staff, police personnel and the alike who are exposed to the virus. People aged 50 and above will be the next in the priority list to get vaccinated. Data of deaths due to the virus show that more than 80% of the victims are over 50 years of age. Hence, the age bar of the vulnerable general public has been fixed at 50. Those are below 50 but having health issues like BP, heart and kidney ailments will be the next set of citizens who will be inoculated. However, if anyone falling under these categories does not wish to get vaccinated, will not be forced. The logistics for the distribution, storage, etc. are almost over. There are as many as 9 COVID-19 vaccines under various stages of clinical trials in India. If everything works out as planned, India will have the capacity to inoculate about 30 crore people by mid-2021. As of now, the total number of COVID-19 infections reported in the country stood at a little over a crore. About 1.45 lakh persons had died, making the fatality rate just below 1.5%. But even as Indian government is gearing up to roll out COVID-19 vaccines all across the country, the new mutated form of virus found in Kent in Britain is worrying the health authorities. The country is not at all capable of handling yet another surge in COVID-19 cases or yet another pandemic. Hence, everyone will be forced to carry over the lesson taught in 2020 to next year too. Nothing is more important than life and health. Given the precarious condition round the corner, there is a growing demand that the central government increase the outlay for the health sector. Presently, the government spending on the health sector is 1.6% of its annual budget. The Narendra Modi government has aimed to raise expenditure on public health services to 2.5% of the country's GDP by 2025. But this or more has to happen now given the situation prevailing and in the offing. Data shows that the cost of treatment has been on the rise in India. Hence, a bigger outlay is warranted, and with the coronavirus back in a more furious manner, it's all the more urgent also. It was recently that Niti Aayog member V.K. Paul has highlighted the need for an increase in spending in the health sector. The COVID-19 experience would justify an increase in expenditure in the health sector. The Modi government is taking these things seriously into account, and a bigger outlay is expected any time from now. The new year is expected to bring hope and better care to combat the pandemic. The new year will witness administration of COVID-19 vaccines and better medical care for all across the country. Please subscribe the channel. Also, click the bell button to get the latest updates.